Once we make the diagnosis of appendicitis, we then have to move on to how are we going to treat the appendicitis. Traditionally, that means taking out the appendix. We still do take out the appendix a lot, but there are some other options available now. Sometimes when the appendicitis is very, very early, people are now using antibiotics alone and not taking out the appendix. If the appendix has perforated or become gangrenous, or if the child's been at home with it for a while and the body has a tendency to wall off the area of inflammation and build a big thick wall around it to protect the rest of the body from the infection. And in those situations, once the appendix perforates and if the process has now been so localized, sometimes we don't operate anymore. We can treat the kids with IV antibiotics as one option and not take the appendix out while they're acutely ill. Sometimes the appendix is perforated and now you have an abscess around the appendix, which is a collection of pus and infection. And sometimes we have the radiologists go through the skin with a small little needle or a tiny tube and take out the pus, leave the appendix, and treat those kids with antibiotics. They get better really quickly that way.